All right, well, let's go ahead and get started. Welcome, everybody. It's nice to see the numbers keep popping up. I know this is an exciting topic. We're really excited to be moving forward. And I know that it seems also kind of silly because the MAHC fourth edition just came out, and to be starting this process all over again. But it really, we really do want to make sure that the Model Aquatic Health Code is the best it can be, that it is up to date, and that it does include the latest science and research. So hopefully you guys have all had an opportunity since its release a month ago to start taking a look at the updated version, the things that changed. And if you guys have any questions or anything throughout the presentation, please don't hesitate to put any questions in the chat, and there's going to be plenty of time for questions at the end. This isn't a super long presentation. It's actually pretty brief. We just want to give you some updates on some things that we're changing to hopefully make the process easier for everybody, for obviously the CMAHC team, as well as all the volunteers who graciously put in a lot of hours, on the TRC committee and the TSC committee. So, and then of course, we want to make this process as easy as possible for those of you that want to submit changes and want to make recommendations and suggestions. So with that, we'll just go ahead and pop in and get going here. So obviously we're here to talk about the change request process, the submissions, and the proposed changes as we move into the 5th edition cycle. So we are really working to change this process to improve it and make it, as I mentioned, easier for everybody who participates. Last year, or well, not last year, but during the last cycle, we received a very large amount. It was over 500 change requests, and it was a lot to manage for everybody. And a lot of them were editorial changes and things like that. So we'll talk a little bit more about that in a minute. But what we're gonna do is change the number of change requests that one person can submit, so that we really want you to think about like what you're submitting, how it's going to affect the code, and why you're making that recommendation, so that we get the best updates in there as possible. So and I mentioned that the hours that the volunteers put in was a very large undertaking, and they do it all for free. It is all volunteer. It is all for the good of aquatics and health and safety, and for this process. So we definitely want to make it as easy for our volunteers as possible. They're giving their expertise and their time, and we want to make this process as smooth and easy as possible. So with that, I'm going to go into this, what those changes are going to look like. So the 4 areas of proposed changes that we're looking at, we're going to limit the change request submissions to 50 entries. Only substantive changes will be allowed, so no editorial change requests. We are going to be looking at, if there is an editorial change, there will be a process to request editorial changes. But and an editorial change is something that doesn't necessarily change the change the code. It doesn't change how the code is written or what it means. So, if there's like a period that you find missing, or a comma that's missing, or, something that isn't going to change what that proposed area says, then we're going to be coming up with a different process for those. And then no MAHC Annex CRs will be accepted, and improving the review process. So that is definitely something that we are striving for. So limiting the number of change requests is going to avoid the problems that were caused just by the number of change requests. 500 was almost, I think it was more than double than we had ever received before. So it makes it really, it made it really challenging for the group to have a good review of everything. And it was just a couple of people that submitted, I think, over 100 change requests. So hopefully, or we feel that limiting it to 50 should still be plenty of change requests for people to submit. I mean, the average is, historically has been less than 10 per person. So it's really going to encourage the submitter to prioritize the most meaningful change requests. So and this would, hopefully this will limit and alleviate all of those issues that we had with this last cycle. As I mentioned, no editorial change requests are going to be allowed, only substantive, I can't talk today. I haven't had my coffee yet, so maybe that's why. But no substantive changes. So anything that's editing for grammar or formatting, we want meaningful changes. So only CRs which address those things that are actually going to change the code in that section are going to be considered. And what we mean too by the definition of a meaningful change is something that's going to change or alter the meaning or provide further technical clarification for any area in any given code section. So just allowing for the grammatical edits unnecessarily bogs down the update process. And so we're really hoping to kind of separate those and, make sure that the meaningful changes don't include those editorial content changes. So the MAHC Annex, we're not going to allow change requests. The Annex is under the purview and discretion of the CDC. As hopefully you all know, that both documents are owned and supported by the CDC. So as the CMAHC, we're just here to help, help and assist with the process of the change requests and coordinating the triennial conference and things like that. So the CDC does have that authority over the annex, and it's also changed with the code. So while the changes in the code are being made, the CDC goes through the annex document and updates any language in the annex that needs to be changed. Changes to the annex adds unnecessary complexity and confusion in the review and voting process. So we're definitely going to keep that a separate process. And the CMAHC does have a standing committee to aid in the CDC updating the annex. So there is a group. If you are interested in being on that committee, please let myself or Dewey know. You can send an email to either of us or into the cmahc@cmahc.org inbox. And we want to have as much participation as possible in our committee. So we want to encourage you again to become members so that you can participate on those committees. And if you're not aware of what the annex is, it is a document that provides the explanation for the data given in the code section. It is actually something I probably look at the most because it really gives that explanation of why a code is there. It gives you the science and the data that says, we chose this because here's that backup information that shows why this code should be in place. So it's a really great document to explain, why certain things are written in the code. So for the improvements, the TSCs will automatically be assigned to CRs to review. So that's not anything necessarily different. As we get in the change requests, Dewey and myself review them. We assign them if it's something about like lifeguard surveillance, or, if it's something about a design, change, or, anything, we have the separate committees that, that's their area of expertise, and we assign those to the TSCs. So those, so that those go to the right groups to facilitate the discussion on those change requests. And we're changing change request champion, or CR champion, to CR facilitator. The TSC and the TRC will be formed when the change requests are open for submission. And then work begins as change requests come in. So that's something new that we're doing this year as well, because in the past, we kind of waited till we had all the change requests. This go around, as they come in, we're going to start sending them out to the different committees, so they can start work on this sooner rather than later, and that there's not all of a sudden there's 200 or 300 change requests that need to get sorted through. So we're going to send those to those committees to start talking through as soon as they start, as soon as we start receiving them. Okay, I think that was everything I wanted to say. Okay, and with that, like I said, there's not a whole, it wasn't a super long presentation. There's not a whole lot of changes, but I think the things that we are going to do are going to improve the process and make it a lot easier for everybody who participates. So I'm going to end this show, and then I am going to see if there's any, that way I can see if there's any, oh, there's a lot of stuff in the chat here. So let's see what we've got going here. So. Yeah, so the limit is 50 change requests per submitter. It's not the total for the membership collectively, definitely not. It's per submitter. So that is per submitter. Let's see. Oh, it looks like Susan's been answering these. Let's see. You guys are good. See, Dewey and Susan are on top of it. Let's see if I've missed anything.
Kristie, you can probably address Tom's question about how the CMAHC website's going to change. The submission process previous was rather awkward.
Yeah, and Dewey, I'll let you talk about that, because I know you've been working, hopefully you guys have all, been on our new website. Hopefully you feel like it's a lot easier to find things and it's a lot cleaner. But Dewey's been working really hard with our web developer on the change request process. So Dewey, I'll let you go ahead and chime in on that.
Yeah, sure, Kristie. So y'all will be glad to know that from this point forward, change request will be an online submission. No more downloading a Word document and making changes and then scanning and saving and sending back. Everything will be fully online. We have integrated components of the old Word-based CR submission and help flesh that out. We did make a few changes, and honestly, I'd have to go back and compare the documents to see what we changed. But we made a few functional changes just to make it smoother. And we're in the process of field testing, so to speak, the submission process now, where we have all the bugs worked out when we open up in April.
Thanks, Dewey. I do want to address
mostly I want to help and have interesting conversation.
Apparently Siri thinks I'm talking to her. I apologize for that. Let's see. I think it would, let's see. Jen, I know you've had some questions about the annex. While we haven't, fleshed out a process for that, or, we do, like I mentioned, we do have the committee. If you have any input you want to provide on that, or anything you want the committee to have, please don't ever hesitate to send it to myself and Dewey, and we're happy to pass that along to the committee or to the CDC or wherever appropriate. So we welcome feedback. We welcome any input anybody has. So if there's something that you have, don't ever hesitate to let us know. And then of course, as soon as we have an official process or how that's going to work with the committee, we'll definitely let the membership know. Any other questions or anything anyone has? Please feel free to just speak up. This is really just an informal letting everybody know what's coming and how things are changing. And yes, April 1st is the target for opening up for change requests.
So Kristie, just kind of pitch in for a second on a
Please.
couple of these. One of the big delays on CDC posting the 4th edition is CDC well above the MAC level. As a whole, the entire CDC website has received a directive to pare down and scale back. So as they work on that paring and scaling, that's going to delay the official posting. But we do hope that it'll be posted on the website for CDC in the near future, whether that's 2 weeks or 2 months, that is everybody's best guess. But that's one of the delays on it coming out on the CDC website. Go ahead.
Sorry, Dewey, this is Jill from Communications. Just adding to what Dewey said, CDC is a lot of the information about the MAC that you're used to seeing on CDC's web pages. We are transitioning to CMAHC's website. So just for awareness there, that some of the stuff will be moving to CMAHC's website. We'll send out links and reminders. So if you're not signed up to get our monthly newsletter, please send me a note or Susan a note, or any of us, Kristie or Dewey, and we'll add you to that list. But just for awareness there, the stuff that you're used to seeing on CDC's, some of it will still be there, but a lot of it we're going to move to cmac.org.
Jill, thank you for that clarification.
Mm-hmm.
On the submission window, yes, we are targeting April 1st. It may be as late as April 15th, but we do plan, whether it's the 1st or the 15th, we do plan on being open for a full 6 months, as been the tradition for the review process. So we'll open up approximately the first 2 weeks of April, and we'll close for submissions approximately the first 2 weeks of October, with a little bit of finessing on those dates. Yeah, that's kind of the range there, and that gives us plenty of time to go back, the TRC, to actually finish any outstanding reviews and open up for the 60-day comment period before the next vote on the code conference in February.
What else? Any questions, comments?
To we'll be putting out a call very soon, within the next probably 30 days, to volunteer for the TRC TSC. That is going to be an application process that will be web-based.
Kristie, you might want to mention the vote on the code, when
Sure.
and where.
Sure. So our next vote on the code conference is going to be held in conjunction with the Association of Aquatics Professionals Conference in February of 2024. I believe it's the week of Valentine's Day again. Am I correct, Susan?
Yes.
Okay, so it's the week of Valentine's Day, February 2024, and it's going to be in Reno, Nevada. And Jill just posted the details in the chat, so there's a link there for the vote on the code details there. Dewey, do you want to talk about the TRC evaluation forms and if they're changing?
Yeah, sure. The TRC evaluation forms aren't really going to change much as far as the content. What is changing is, again, we're making this all web-based. So, you know, just like the CR submission process, evaluation forms for the TRC and the TSC were similarly bulky in that you had to fill out this awkward Word document, save it, scan it, send it in, all that jazz. The actual content will remain the same, but it will be web-based in submission. So we hope to make that a lot more user-friendly and respective of our TRC and TSC volunteers. On that matter, right, so I mentioned earlier to Kent's question on application process. One other significant change is with our TRC chair and vice chair selection. In the past, the selection was more arbitrary. So we have added some selection criteria, minimum 5 to 10 years in either the aquatic industry, public health, or a mix of the two experience. We're adding in there prior experience with the MAHC in some form or fashion, either on the initial development or for any of the update processes. And we're also adding in that it needs to be a CMAHC member. That'll be listed on the TRC and TSC application forms when those are open for submission. And you can see the full listing there. Another significant change to TRC chair and vice chair selection. We will continue with the tradition of alternating roles, right? So for example, if the chair comes from public health, then the vice chair will come from the aquatic industry. The major difference is the board of directors will aid the staff in selecting the chair, vice chair. This was a change that we've been contemplating and ultimately put in place to make the process more transparent, make it more official and more formal, and make it feel less like, you know, Kristie and I are having backroom conversations on who we want to be the chair, right? So just trying to make the process as transparent and official as we possibly can.
Thanks.
I would like to go back and answer one more other question that Jen asked on the process timeline. So the only thing that's really happened is that we've shifted, right? So instead of having CR submissions open from June to January and then vote on the code that following October, we're just shifting that process over into April. One thing that is so in the process, right? The moment we open for CR submissions, that opens the first comment period. The first comment period closes at the completion of the TRC review process. So comments will be submitted the entire 6-month period. The second comment period that will still open 60 days prior to the vote on the code, and we'll still have a window after vote on the code where the submitters can modify their CR based on feedback. And a final TRC evaluation period for any modified CRs. None of that changes, that still holds. Again, we're just shifting from a June submission, July closure to an April submission, October closure. The only other thing that's changing in that process is that traditionally, the technical review committee has waited until all CRs have been submitted to start the review process. For this cycle, we're going to review concurrently. So the moment that CRs come in, we will start the review process. and we'll continue that through the closure period. We will have a mechanism in place for any submitted changes or submitted comments to be re-reviewed throughout the entire 6-month window. The reason for that change is historically, we've had all of these change requests come in, and then it's basically 2.5 months of 4-hour meetings every 2 weeks, which has been very difficult for our volunteers. So changing that process up, instead of having marathon meetings, we can accomplish the same quality review and probably better quality review, to be honest, with much less stress on volunteers. So a 1.5-hour meeting every 2 weeks versus a 4-hour meeting every 2 weeks.
There was a question that came in about the revision process still being 3 years, or has this been officially changed? And it has not been officially changed. I know obviously we've gone over a bit. COVID obviously played a huge role in that. The CDC was really tied up obviously with the response on COVID. And so we obviously are kind of off of that track a little bit. I know that the CDC is currently having internal conversations about this and about the process and what makes the most sense. So if anything does change, we will definitely let everyone know as soon as possible, but nothing has officially changed as far as the timing of the change or the revision process. Someone had also asked, I know Susan answered it, someone had asked if the conference was going to be before or after or during AOAP, and it will be after. It'll be that Thursday and Friday after AOAP. And Jen, you had asked about the cycle with members, and typically it's a 3-year membership. We are we're trying to figure out exactly the best way to do that. Right now, we're still keeping it on the current 3-year cycle. And if we need to make an adjustment, we'll be looking at that. But we haven't. We're keeping it the same for now. And then we'll see what comes out of the internal discussions at the CDC if we're going to be changing anything. Someone had also asked what the benefits of being a member are, and we are really striving as the CMAHC team, coming together with ways to provide more member benefits. Obviously, these webinars have been something that we've been offering free to members, and there's a small fee. Typically, I know this one was free because we want to make sure everybody gets the information on the change request process, because you don't have to be a member to submit a change request. However, you do need to be a member to be on participate on any of the committees. You do get the webinars for free. We do quarterly webinars free to members, and it is a small fee for non-members. We also, you do have to be a member to be able to vote on the code. So while you can submit change requests, you do have to be a member to participate in voting. We offer discounts for conferences. As a member, you get a discount if you attend the vote on the code as a member. And then we have a lot of discounts that we offer with our partners if you're a CMAHC member. So CMAHC members, might get a discount for another conference that we partner with someone. I know we've given, there's been discounts given for the World Aquatic Health Conference if you're a CMAHC member, as well as the Association of Aquatics Professionals conference. So we're doing everything we can with our partners to create opportunities and provide more content That's a big thing that we're working towards as a team, is to provide more content for members. So there's a lot of really great benefits to becoming a member. If I missed anything, team, feel free to chime in.
Just one thing that's on my to-do list is, one of the things that we want to do with our monthly newsletters is start spotlighting our members and sharing their stories and about the leadership that they're exhibiting in the industry. So hope you'll see that coming soon. And if you are a member, if there are any members on this call and you're interested in being spotlighted, you could shoot me an email.
Awesome. Thank you, Jill. Anything else? Any other thoughts from the team that you guys can think of that maybe we didn't talk about? All right. Well, thank you, everybody. Oh, Jen, let's see, you had another question. Yes, if you if you became a member and were expecting to be a part of that membership going through the next vote on the code, yes, that will be honored. So so you will be good. Yes. All right. Well, thank you so much, everybody. We do have another webinar coming up towards the end of the month. I believe, is it March 23rd? Is that right, Dewey? March 23rd?
Correct, 11 a.m. Eastern.
Perfect.
And we'll be sharing some promotions about that coming Monday. So stay tuned.
Awesome. Thanks so much, everybody. Have a wonderful day.